excited to be here today, premiering our very first VisuCast with none other than Dr. K. Jewell. Dr. K. Jewell has worked in healthcare consulting in the area of health policy, performance measurement, coverage and reimbursement from the provider and payers' perspectives, and advocacy with genetics, testing, and pharma for over 30 years. She's worked with genetics testing, addressing commercialization and coverage and payment, as well as claims auditing for providers, labs, and payers alike. She served as medical officer at CMS Medicare and medical director for the Wisconsin Medicare Part B contractor. She currently serves as medical director for the AODA clinic and volunteers with a local juvenile detention center focusing on mental health strategies and coping. Her volunteer work includes service on the NAMI Wisconsin Board of Directors, serving as a trainer for peer support facilitators and NAMI peer education programs for parents. As a teacher for NAMI psychoeducation programs for parents, peers, and family members of veterans active duty military. Dr. K. Jewell is extremely credentialed. She received her medical degree from UW School of Public Health, trained in internal medicine at Madison, excuse me. And so without further ado, we welcome Dr. K. Jewell. Applause, applause. We're so excited to have you on our very first VisuCast episode about coronavirus. Welcome.
Thank you. It's a pleasure. It's a pleasure to be here with you. This is definitely a topic of great interest to many people and has occupied a huge amount of my time over the last few months as I've worked with different labs and hospitals and nursing homes and others and schools in terms of how to be safe, what it is, and where we're going from here. Thank you.
We have noticed that there has been a lot of confusion around coronavirus. It is very, heavy topic, and it's not one that you can easily explain, in my opinion, or at least understand, because as a non-medical professional, we have been working a lot. When I say we, me and my family have been working a lot to sort of understand this. And I see now that it's something that we need some extra support, i.e. a medical professional like yourself breaking down some of these larger concepts so that we can really learn how to be safe, which is the purpose of our VisuCast. And so if you are in the audience and you have questions around coronavirus, we're hoping that we can answer some of those questions today. So I'm ready to jump right into it. Are you ready, Dr. Jewell?
I'm ready.
Awesome. Okay. So the very first question, please, can you explain for us, what is the coronavirus? Where did it come from?
Well, the coronavirus actually has been around for a very, very long time. It's a type of virus, just like we know about viruses that give us colds and the viruses that give us and other kinds of infections. The coronavirus is just a different kind of virus. And it's like a common cold in the past, the versions that have been around for a long time. There have been two versions that have been pretty deadly in the sense that they didn't affect very many people, but many of the people who were affected did die, and they're called the severe acute respiratory syndromes, SARs. So that's why this virus is often, if you read anything online, you might see it's called SARS-CoV-2, and it's called number 2 because there was one that came before. So it's a virus that's been around before, but this is a version that's it's kind of learned a lot. Yeah. This time, this virus is infecting lots more people than any of the past ones, and it's much more severe than any of the past ones were. Like I said, the first 3 are more like a common cold. This one is a lot more intense than that.
So in playing off of that idea of, this is a little bit more serious, how serious is this? Because I feel like there have been lots of mixed messages around the level of seriousness, and even at times some candor thrown around about the importance of, you know, wearing a mask or protecting yourself. It's been even likened to like the colds or even the flu that we see coming around seasonally. Is this like the flu? Is this very serious?
It's different than the flu. It's a respiratory virus like the flu, but the flu is different. First off, it happens faster. If you get exposed to somebody with the flu, a lot of times you'll get your symptoms within a day. You'll get infected within a day and it'll show up, and you're infected to other people just for a couple of days. Last year, there were 38 million people who were considered to have the flu. And out of that 38 million, 22,000 died. So if we look at the comparison with where we are with COVID infection right now, we're looking at today, as of today, 8 million were thought to have been infected with COVID, and we are at 220,000 deaths. So for the flu last year, there were 22,000 deaths, and we're all at 220,000 and still counting. So it spreads easier. You can be infected. You're infected for like 2 days before you have symptoms even. So there's a lot of people who can get affected by those first 2 days when you didn't even know you were sick. And then you can also infect people for even more days after that, up to 7 days. So it's different in a lot of ways. The regular flu, like they've measured it if it's on the skin. On the skin, the flu virus will last about 2 hours, and the COVID virus lasts about 9 hours. Wow. So it's a tougher virus. It spreads harder and for a longer period of time, and more people are dying from it than die from the flu.
So can you say a little bit more about that? How exactly does coronavirus spread? I heard that you talked a little bit about surfaces, but how does it spread, and how does it spread so quickly?
One of the estimates is that if for one person, each person who's infected will infect 2 or up to 2 more people. So it kind of blossoms really quickly in terms of the number of people who get infected. And it's like a lot of the other respiratory infections. It's spread by sneezing and coughing, the stuff that comes out of our nose and our mouth. It's also when we cough or when we speak or sing. When we speak and sing and shout, we're much more forceful, and sometimes even spit comes out, and it sends big droplets out into the air. And if you get in contact with those droplets, that's how people get infected, is from contact with those droplets. With time, the big droplets will kind of fall, they sink, but there's also little tiny droplets, or it breaks up into little smaller pieces, and those can hang around for a number of hours. So you can even get infected by hanging around or being in that in an area where somebody has been infected when it's just hanging around. That's why they say, like, if somebody's running, that you don't want to run right behind somebody because they're breathing out. And if they're infected and you're right behind them, you're going to be picking up the air that they just infected. That's why we talk about wearing masks or being 6 feet apart, because it's thought that the big droplets will fall and won't reach 6 feet.
Right. That's a really good question, because the other day recently, I saw people who were working out with masks on. And so it, made me think about some of what you just touched on with how we protect ourselves against coronavirus, because, we have to go out most times unless we are in states where we're not advised to go out. We need to go to places like the grocery store and things like that. So while we're out and about, what are the recommendations around protecting ourselves from the virus?
I think the biggest, there's 2 big ones, and there's probably 3 that we could hang in there. The first one is wear a mask. You're mostly protecting other people just in case you're infected and you don't know it. so that you won't accidentally infect somebody else. It also does a little bit to help you to be protected because you're not breathing in other people's droplets also. And also 6 feet distance, so just in case there's some in the air, you're far enough apart that you will hopefully not pick it up from those people. And then the final thing is to wash your hands, use the hand sanitizers. And then I know a lot of the businesses now and a lot of people have hand sanitizers that you can use all the time. So those are probably the 3 biggest. Oh, one big one. If you don't feel good, don't go out.
Yeah,
it's disheartening the number with parents who have sent their children to school. It wasn't just that they didn't feel good, they were positive for testing. So you know they're going to be spreading it. So if you don't feel good, even if you don't know if you have it or not, don't go out because you don't want to accidentally infect somebody else.
Those things are really, really important, and we see them all the time. But I still feel like at times we may feel a little miseducated. I actually have my son's mask here. He loves Batman, and so here's one of his masks. How, what's the difference between the different masks that we see? I feel like people have made an industry and businesses, to monetize sort of the pandemic in a sense. And so I want to make sure that I am picking up the right kinds of masks. And I even see face shields and I see masks with filters. And sometimes it can be really overwhelming when wanting to keep my family safe. Is there a particular mask and a particular way that we're advised to wear our masks to make sure that we guarantee that we're safe?
That's a good question. And when you're out in public, you often wonder about that. The main thing for us, those of us not in the healthcare setting, not working with people, the main thing is a mask, the more layers. So some of the masks are like double layers. So if there's a double layer, that gives you even more protection. The challenge, of course, is what they make those layers out of so that you feel comfortable breathing. And they have done studies and it doesn't affect it. People, if you have healthy lungs, wearing a mask is not going to give you a lot of challenges. It's not going to give you bad air. The important thing is to cover your nose, and as much as you can, you want to keep it as tight as you can around because you don't want things to leak out air, basically air, and everything else to leak out through the sides. The challenge with the vented ones is that you're blowing air out and in, even if it's got a vent on it, that you potentially are still passing air, and it depends on how fine the vent is, like a strainer, how fine it is, how much can still get out or in. And so vents are generally not recommended by CDC. The one, most of the masks, when they've tested them, seem to do pretty well. The one that's, many people like to wear things like bandanas. Those seem to do sort of okay. The one that didn't do well and actually caused more problems were, it's those kinds of things where they pull up their collar, over their nose. Those tend to have even a higher rate of getting infected. So some people are more comfortable wearing them because they, psychologically feel better, or it doesn't affect their ego as much, but they're not as safe. They're definitely not as safe. But the most important thing you want is to keep it as close as you can and tight. Of course, the real challenge for those people like me with glasses is they steam up.
Yes, they do.
And it's a real challenge. I have read somewhere that somebody said if you treat your glasses, and we've tried that, you treat it with certain things that it won't steam up, it still does. The only thing that might help is sometimes the mask can have a piece of wire or something in that so that you can poke it down so it's closer to your nose. Sometimes those help.
What about the face shields that we see? I've even seen this new mask that's plastic and it adheres to your face. It kind of has hooks glasses around them and comes around by your nose. What about things like those? Those are these new sort of niche ways to protect yourself. Are they doing what we think they're doing?
I haven't seen anything where they've actually looked at those. In the clinic setting, they, in addition to wearing a mask, they'll wear a face shield, and what that's for is more to protect their eyes, so that they don't get any droplets in their eyes and get infected that way. But sometimes some people will say, well, I'm wearing a face shield, that should be enough. It's not. It doesn't replace a mask. It's like I said, the face shield is really for your eyes, and the mask is for your nose and your mouth.
Well, that's really, really good to know. But let's say that we were incidentally exposed. And so we're hearing these words, exposed versus diagnosed. What is the difference? What happens if I am exposed to COVID? And what's the difference between being exposed versus being diagnosed, especially as we talk about the amounts of days that we have to quarantine between the two?
Well, if you're exposed, what the CDC says is exposure, there's two basic ones. One is you actually somebody coughed and sneezed on you. That's a definite exposure. Another possible exposure is if you're around somebody who is positive and having symptoms or no symptoms, but if they're positive, you're around them for more than 15 minutes. And that doesn't have to be 15 minutes all at once. It could be that you're there it's a 15 minutes total time that you're around them. And you're not able to wear a mask and you're not socially distancing, all those kinds of things, that would be a significant exposure. And if you've been exposed, they'll usually tell you to do a test. And that's the current recommendation, is to be tested. And the time to quarantine, it's called quarantine, which means you have to stay away from people, stay away from work, stay away from home. As much as possible, don't go to the grocery store. I had to quarantine for a short period for once. Go order a grocery line and go pick them up, so then you're not having any contact with people. And it's 14 days. And even if that first test is negative, that doesn't matter. Well, it does matter because it means you're not infected, but you still have to do the 14 days because you could get exposed, and it takes from 2 to 14 days for somebody who's developed to be exposed to develop the infection. So you may not actually start having symptoms or turn positive until the 14th day. So you can't test out of it. You gotta stick it out for 14 days. That's different than if you're symptomatic and you test positive. It usually takes about 10 days, for plus or minus, for people to kind of get through being sick. And during that time, you can be infecting other people. So that's why if you are positive for it, they say 10 days that you have to stay away from other people. 10 days with 24 hours that your symptoms are better and you don't have a fever. Then you can go back out around other people.
So I heard you mention about symptomatic, and one thing that's driven lots of us crazy about COVID is that you can have it and not experience any symptoms, which we're hearing is called being asymptomatic.
Yes.
What does it mean to be asymptomatic? And does that mean that because I don't feel sick that I can still be out and about with COVID?
If you're asymptomatic and you test positive, you are still able to infect other people. Even if you don't have symptoms, you can infect other people. So if you test positive, it's 10 days that you need to isolate, whether you have symptoms or not. They've had different numbers. We're trying to understand this virus in terms of how it affects people, and because it behaves so different than other viruses we get. And at some point they said, well, about 40%, or that would be not quite half of people who are infected don't have symptoms. But they're also saying that most people who start out without symptoms do develop some symptoms, even if they're not very serious. The bottom line is, if you test positive and you don't have symptoms, you can still infect other people, and you still need to isolate yourself for 10 days plus.
Okay, well, that's really, really good information. So let's sort of talk about testing, because once again, this is an aspect of COVID and sort of managing our lives that is completely different than what most of us are used to, right? So, usually when we think of testing, we think of like testing that may be affiliated with an illness that I'm feeling symptoms for, or it may be like workplace testing, drugs, or things like that. But with coronavirus, it's a little bit different. There are lots of different types of tests, and we've even been given information that some tests seem more or less valid than others. Can you tell us a little bit about, about testing, and is it important? Is it a practice that we should be doing, and how often, if so?
Well, if you have symptoms, a person can have symptoms and like they go test and they're negative. It could be that they're testing too early, because you have to have a certain amount of virus in your body and in your those nose swabs. You have to have a certain amount for the test to pick it up and recognize it. And so you can still be infected even if a test is negative and you still have symptoms. And usually that's diagnosed, the doctor or the nurse practitioner or your healthcare person will tell you, we still think you have it and you could retest if you want to. The test that has the strongest, is the most reliable and sensitive, it's called the gold standard, it's called the PCR test. It measures the nucleic acid, the actual nucleic acid, the DNA content basically of the virus, and it recognizes that, and then it says, yes, this is positive. Those take a few hours, and the challenge is they have to be done in a lab, a special lab that is able to do complex testing. And the frustration is that it's not necessarily how long the machine takes to run the test. It's how long does it take to send the sample to the lab, and the lab runs the test, and then the lab gets the results back to people. So there's this delay in getting the answers back to people. And that's a frustration, and it's an important thing to get the results back soon, especially if you're positive, so you stop being around other people. There are other tests. Everybody wants the other tests that can be done faster. I think the president talks the most about the one that he has, that is a little box. It's like a little toaster size. They can be used in like doctor's offices, where you can get the results within 15 minutes or up to an hour. The challenge is that they're doing a different kind of test. They're looking at a protein on the virus, so it's a different thing that's being measured.
Got it.
And they're not quite as sensitive. And the ones that are currently out there and have been approved are approved for people, using them in people who have symptoms, and they're in the first 4, 5, 7 days of having symptoms. So that's when you're going to have the most virus, that you're going to be able to pick it up by this test. The challenge is that sometimes people who are being tested, like if you've been exposed, you don't have symptoms, you've been exposed. If you get this test, it's called an antigen test. It's not as sensitive. It can have more false readings on it. And then if you're in that category of you don't have symptoms and there's not too many people in your community who are having positives, your positive could be false. Mm-hmm. So then they recommend that you either repeat the test in a couple days, or a different test, or you do one of those gold standard PCR tests that will then definitely identify whether you have, whether you're infected with the virus.
That information is really helpful. And, as we're thinking about testing, we also have seen different ways to acquire sampling from tests. And some appear to be less comfortable than others. Does the comfort level of a test, meaning that long Q-tip that we're seeing, that they're getting, the sample from the back of your throat, is that more valid than, let's say, a mouth swab, or if they ask you to put saliva into like a small container or something like that? Is there any sort of weight in the validity of how they acquire their samples?
In the past, everybody has in the sciences that one they put down back, shoved down in your nose to the back of your nose. It's a nasal swab, and that's been thought to be get the best sample to see if you have a positive or not. What they've done is the FDA has required labs who are developing these tests to say, okay, if you want to do a swab where you just go in the front of the nose, like just in here, not all the way to the back. But they've had the lab, before they approve the test, they've said, okay, show me, do a test on you with both of them, and then we'll compare and see if we get the same number of positive tests and negative tests, so that we know that it's just as good whichever way you go. And they're doing the same thing, and that's why they now can allow testing where you just do the front of the nose. They've also been wanting to do the saliva tests, and they've done the same thing. They've said, okay, do some with saliva. For every person you test their saliva and test their nose, and then compare the results. And they're finding that the saliva tests are doing pretty good. They're not quite always as good depending on the test, but they do pretty good. And so more of the new tests that are coming out do allow for saliva testing.
Okay, guys, so do not fear. There is hope for those of us who do not want the long Q-tips stuck to the back of your throats.
Wait, can I just say one more thing?
Please do.
One of the challenges is it's not necessarily whether the test can use, which one of those the test can use. One of the challenges that we're having is that we've run out of supplies. Some of the labs and some don't have all the supplies that they need, like they don't have all the swabs that they need, or they don't have the kits to put things in, because you have to put them in, some kind of a container and send them off to the lab. So sometimes they don't have the kit so that they can do the short ones or the saliva, and they have to do the tests that they have the supplies for. It's one of our challenges.
Well, that makes a lot of sense. And I'm sure that, the medical industry is overwhelmed at this point with, a large majority people who need to get tested, and then the other majority of people who feel like they need to get tested, which I can imagine is probably really difficult. And so the last sort of question that I wanted to ask is sort of about the landscape of COVID. So, when it first came, and I would say like in the height, and I'm located in Maryland, when March hit and we were told to prepare, we prepared very much like a snowstorm. We all went out to the grocery store, got as much of everything that we could, including our favorite snacks. And we envisioned a 2-week time span where we'd be in our homes, very much like an extended snowstorm or some type of emergency. And, we were assured that as weather changed, or as weeks happened, or as we, continued to be socially distant, or as we did different things, that we'd see coronavirus levels or numbers really starting to go down, which we did at some point, at least on our end. And now we're seeing throughout our country spikes and a forecast of spikes. If your state doesn't have a spike yet, it's almost like just wait, because there's a wave coming. And so I guess my question sort of is, in your medical professional purview, how do you anticipate sort of this winter season that's coming, or the current season as you're in Wisconsin and things are already sort of spiking there? How do you see us needing to sort of prepare ourselves for what's to come? Or what's to come? What is to come?
Well, it's interesting that when this all started, the highest number of transmissions or people getting infected from other people were happening in the workplace. And we heard all about that. And so the workplaces have worked really hard at trying to make people more protected. And I went on over the summer, it's now shifted. So it's not so much the workplace. As schools started to open, it's partly actually going out and socializing and opening in the bars, and where people in restaurants where people were standing right next to each other, talking loudly because it's noisy.
Right.
And you're singing and you're dancing, and so there's lots more transmission. It doesn't take very much. At one church, in one church, two people
Yeah.
went to church and ended up infecting 200 people. So
Wow.
it kind of grows fast. What's happening now is more of the infection happening, is happening in the homes. It's when you have small family gatherings and one person has been going out and has been in areas where people are not necessarily protected. And so you pick it up out there and then you bring it home, and then more of the people in the home are being infected. So it's still the issue of the different gatherings that we have where people are not wearing masks or practicing social distancing, because then they're spreading it.
Right.
And then we bring it home.
That's disheartening, to say the least, considering that it's holiday season and everyone's going to want to be together, but it's not necessarily worth our health, of course. And so as we wrap up, we got a lot to digest. You've gone through a lot, and we're super appreciative of your time and your expertise. But before we go, I can't leave without you giving us, maybe 3 to 5 practical tips, just takeaways that we need to keep in our back pockets as reminders for how to manage ourselves during the coronavirus.
I think we know a lot about those physical things that we can do, the masks, the social distancing, washing a lot. One of the things that's showing up a lot now is how it's affecting us mentally and socially, that people are feeling fatigue. One of the things people miss the most is touching each other.
Yeah.
You don't realize how that casual touch means so much, let alone the hugs. And so some of the socially connecting, finding ways to have those gatherings where you can be safe if you're in the same building, and using the Zoom, using the phones, using different ways of face-to-face. It helps to see somebody's face. Telephone, just a conversation, doesn't give the same sense of connection, so that we can deal with the feeling separated and feeling isolated and feeling, we have lots more anxiety and depression because people don't like being isolated, and it's upsetting, and routines are upset. So anything you can do to make up new ways to have game night on TV, game night on Zoom, share dinners by Zoom, make some other connections. It's really very important.
Well, there you have it, ladies and gentlemen. We and the doctor, she said it herself, we know some of these very important physical ways, but that mental health is so, so important. And so we've got to make sure that we're catering to the mind, body, and of course our souls. And so we are so grateful for our first episode of VisuCast with iLabConnect. Thank you so much, Dr. Jewell. Your expertise has been super helpful and valued in this space. And so we thank you so much. And I'm really, I'm just so grateful, and I'm looking forward to episode 2. So we thank you so much for your time. And everybody, ladies and gentlemen, thank you so much for listening and tuning in. And we hope that we will have you in our audience again next time for episode 2. Good night. See you later.